And welcome to the Dr. Bob Show. When you wake up in the morning, how are your sinuses? Do you have a stuffy nose? Do you have drainage? Do you have sniffles? You wish your nose would be open. You wish it wasn't causing so much problems. Could it be something in the bedroom that's making your nose get stuffy during the night? Could it be allergies? Could it be dust allergies? Could it be dust mites? We're going to be talking about dust mite allergy and how they cause problems with our health, especially during the night. My guest is Dr. Nick Kolinsky. Dr. Kolinsky is a board-certified allergist, and he deals with dust mite allergies every single day. He'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about how important your sleep is to staying healthy and staying happy. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Nicholas Kolinsky, board-certified allergist, and we're going to be talking about dust mites, which will cause much more problems to your health than you really realize. Nick, welcome to the Dr. Bob Show.
Thanks, Dr. Bob. It's good to be back.
It's good to have you back. Now, tell me, what is a dust mite?
So a dust mite is a microscopic creature, and it's actually related to the spider, so it's an arachnid, and it lives off the ambient humidity in the air. Okay, so it doesn't actually drink water. And then it feeds off human and animal dander as well as mold. It likes dark, damp, warm places, so it's pretty prevalent.
So that makes it fairly prevalent in a bedroom.
Right.
The humidity level in a bedroom, is it the same as the rest of the house? Do you have to change the humidity if you're going to want to get rid of dust mites? What do you do?
Ideally, yes, sir. So you want the humidity level to be below 40% ideally, because dust mites can't really thrive since they're feeding off that ambient humidity in the air. You're going to want to do other things like wash your bedding and sheets in the hottest temperature possible, but ideally greater than 130 degrees Fahrenheit. You can use dust mite proof encasements that are these zipper.
I happen to bring one of those with us here. So
fantastic.
This is an encasement for a pillow. Looks like a pretty large pillow to me.
That's right.
But what are the characteristics that you're looking for in a cover that goes over the pillow?
So this right here, it's going to have a zipper on it. It has to have a zipper. That's definitely key. That's going to seal the dust mites in, and that's the goal, okay, where the dust mites can't really get to you and you can't get to the dust mites since it relies on you to live.
Is it the actual dust mite we're allergic to, or is it their fecal pellet, or is it the scale on their skin, or is it all the above?
So it's generally both the dust mite and the fecal pellet, but more so the fecal pellet.
And how big is a dust mite?
We're talking microns, so really, really small, microscopic.
So 3 to 4 microns, which is bitty, bitty, bitty. So the covers are made where anything around that range won't get through to your nose.
Right.
So it encapsulates, or it covers, locks in, makes it where the dust mite droplet can't get to the nose. Now, if you didn't have a cover and you were breathing in dust mite droplets or pellets, how would it cause allergy reactions?
So generally what happens is that an individual is exposed to dust mites, and some people develop IgE, or the allergy molecule that's specific to dust mite. And what ends up happening is that you have these cells called mast cells, and IgE sits on the border of those mast cells. And on re-exposure to dust mites, that allergen, or the dust mite, will bind to the IgE that's bound to the mast cell, and when that happens, the mast cell bursts or degranulates. It releases things like histamine, leukotrienes, things that cause the edema, swelling, mucus, stuffy nose, runny nose, cough, sneeze, all those other symptoms.
So when somebody wakes up with stuffy nose, nasal congestion, sneezing, itching nose, blowing their nose, you have to think of the possibility of dust mite allergy. Could it be other things?
It definitely could. I mean, it's all in the history, okay? So if someone keeps waking up in the morning, they don't have a pet, and they have congestion, they don't have other things like reflux, obstructive sleep apnea, you ask a lot of questions, and then you ask more questions, and then you do some testing, and then you arrive at a diagnosis. Of course, a lot of people like to have their pets sleep with them, and so a lot of people are allergic to their pet. That's very, very common. While we're on that topic, one thing that they can do is get a high efficiency filter or a HEPA filter. That's really good actually for dust mite and for pet allergy, but more so for pet.
Do you put those filters in the bedroom where the person's sleeping, or do you put it on the main filter?
So ideally you want it in the bedroom where the person is sleeping. The reason for that is because dust mite allergen is very heavy. And so whenever you move the sheets or you jump on the bed, the dust mite allergen kind of goes up in the air, and it'll stay in the air for about 15 minutes, but then it falls. Whereas animal allergen or cat allergen especially, it's very light and buoyant. And so that's going to be really filtered out through that HEPA air filter, and that's going to be a very effective thing to do.
So allergies in the bedroom are pretty prevalent.
Definitely.
And can be a huge problem. Do medications help in that type of allergies? Is it any different from ragweed hay fever, or from grass pollen hay fever, or from problems with mold spores? They produce the same type allergy reaction. Is the treatment the same?
Right, it is relatively the same. There are some exceptions, like as far as maybe a sublingual immunotherapy tablet for dust mite. But in general, you're still going to use your nasal spray. A nasal corticosteroid is at the top. You've got your nasal antihistamines. On a scale of 1 to 10, 10 being the best, nasal sprays are probably a 7 or an 8, whereas allergy pills might be a 2 or a 3. So if there's one thing to focus on, it's a nasal spray, correct technique, things like that.
So let's talk about nasal spray, and let's talk about a cortisone nasal spray. How do you spray it? What does it really do to get the person better, and why is it better than the pill?
So I think it's very important to know the correct technique. You could give someone the best medication in the world, but if they use it incorrectly, they're not going to get the right effect.
So you don't spray it in your ear?
You don't spray it in your ear, you spray it in your nose, and here's how you do it. So the septum is that wall in the middle, and so you want to aim away from the septum. So left side towards the left ear, right side towards the right ear.
So you can actually put the nozzle into the nose and then aim toward the top of the ear on that side. Why do you stay away from the septum?
So the reason for that is because the septum is highly vascular, which means it has a lot of blood vessels in it. And some of those nasal steroids like Flonase, Nasacort, Rhinocort can irritate the septum and cause nosebleeds. So that's a very important detail.
So you get sort of a raw nose, and you get minor bleeding that has crusting and bothers the patient.
Definitely can.
So you teach the patient to spray toward the outside. Does that do just as good in its activity against the allergic reaction?
Well, you want to use a nasal spray more often than not, and it's going to work better regularly. So you might already have an allergic reaction, or you might have symptoms and then start to use your nasal spray. You might get better, but you wouldn't get as better or if you were to use it earlier, or if you use it on a continuous basis. So more often than not is what I recommend, but I use my nasal spray almost every day.
So when you use a nasal spray, if it's a cortisone nasal spray, do you use it at nighttime before you go to bed, or do you use it in the morning when you first get up when your nose is stuffy?
Right, so I'm actually dust mite allergic. I'm allergic to cats, dogs, pollen. So it all depends on the history.
Lucky?
Yeah, I know, right? So I know I'm going to get my dust mite exposure primarily at night in my bed. And so I'm going to definitely have my nighttime dose, but then I'm also pollen allergic. And so of course I know I'm going to get my pollen exposure during the day, so I'll use it twice a day, 1 to 2 sprays each side.
If you're using 2 sprays each nostril, morning and night, are you more likely to get some side effects?
Most definitely. I think with the higher doses, you definitely could, and that's why it's so important, and I go over it with every patient, every visit, the correct technique, because I think it's that important.
And a lot of times you tell the patient give them so much information that it's easy for them to understand that when they're in the doctor's office, but the minute they walk out, they say, "Now, what did he say?" Right. So I think it's so good and so nice and so good for the patient that you re-instruct them each time on how to use a nasal spray. Now, you mentioned there are pills to use. Are they effective also?
They are effective.
And that's what we'll be talking about when we come back. The pills are effective, but not as effective as the sprays. Can use them both. Should you use them both? We'll talk about it. We're talking with Dr. Nick Kolinsky, board-certified allergist. We're talking about dust mite allergies and how they cause problems more than we think. They feed off the scale of human skin as we shed our skin every day. They like high humidity. They don't do well if we give them a low humidity. And they like stuffed furniture where they seem to live better. Nick, is that right so far?
That's correct so far.
So let's look at the set right here. Tell me what you see in here that could have a lot of dust mites, even here in the studio.
So definitely this carpet, I would say so for sure.
So we've got a carpet on the floor. So carpet, the dust mite likes to live in carpet.
Yes, they do.
Any special type of carpet that they don't like? Or it's the humidity? What's in a carpet that bothers?
So sometimes what can happen, you're going to have your dead skin cells, they're going to slough off and be on the carpet. There's going to be animal dander. If you get your carpet steamed, there might be a lot of humidity down there, moisture, going to be good for dust mites and mold. So carpet's just not a good idea if you're an allergic individual, especially to dust mite and mold.
So in the bedroom, we take the carpet out. A throw rug, is that okay?
A throw rug too, it's a problem.
Yeah, so you got to have cold toes when you jump out of bed in the morning. So what else do you see in here? You got the carpet.
Right, and then of course we have this furniture here with a cloth covering.
Yeah, and the cloth covering here is a dead giveaway for what's bad because dust mites are going to be there.
Right, right.
So when we pound on those, rub those, lay our heads on those, when we watch television, we're really close up to the dust mite, and if we're allergic to dust mite droplet, we'll have problems there. What else do you see?
So we've got the curtains back here behind me, and so curtains are another thing that's going to collect a lot of dust, and so ideally you want to remove curtains. And then also this ornate type of decoration back here, that's going to collect a lot of dust, and it's very difficult sometimes to dust something like that. It looks great, I love it, but it's going to be tough to dust.
So how about the headboard? When we lay down on our bed at nighttime, what's a bad headboard?
A bad headboard is going to be like a bookshelf or a bookcase, something that's got a lot of levels on it. It's going to collect a lot of dust, and it's just going to fall off and you know, triple all over you and all that kind of stuff. And so I think it's going to cause a lot of symptoms.
What about the bedside table? What should that be like?
So it should be clear. It shouldn't be cluttered. If you got a bunch of stuff on there, you got your cell phone, your coaster, your glass of water, maybe, who knows, a book, everything else.
So you want to keep that clean, keep that simple, keep the headboard clean and simple and not ornate.
Right.
Because anything that you can do to cut down on your exposure to dust mite may well help the degree of allergic problem that you have. The vinyl covers for the pillow, can you get those at any department store usually?
You can generally. So a place like Amazon or online is a good source. Just be sure that you kind of read into it, make sure it's got a zipper. That's a common mistake I've seen. But yes, you can get it at a lot of places.
Why is the zipper a mistake? To not have one?
Right, well, you're just wanting to be sure that you seal in that dust mite. If you don't have it, a zipper, or if it's just gonna kind of have the elastic band that wraps around, you're not really gonna get that good seal. There's gonna be plenty of dust mites that's gonna be able to get around that.
And when you lay down on that pillow, poof, the air will find its way right to your nose that way. So it's really important to do that. You mentioned washing in the hot cycle, 130 degree temperature. It seems to scald and kill the dust mite. So that pretty much covers it. The medications that you would use at nighttime, we talked about cortisone spray it toward the outside. How much, when you spray it, how much do you sniff?
So you really don't want to give that aggressive sniff. Otherwise, it's going to drag the medication in the back of the throat and you're going to swallow it, but we want it to stay in the nose.
Okay, so you spray it to the side and just so it doesn't fall out on your face, and do it that way. What pills are good? Did you take those in the morning, take those at nighttime?
So as far as oral antihistamines, you can take it in the morning or at night. It just kind of depends on your symptoms. If you're going to get that dust mite exposure at night, I would probably take it at night. My favorite one is probably Allegra, just because it's the least sedating. So if you have to wake up and go to school, go to work, drive heavy machinery, it's probably a good idea to use a medication like that.
So there's 3 or 4 non-sedating antihistamines.
Right.
Allegra is the one that you found that causes less sedation. Zyrtec, 14% of people can get sleepy with it, as I remember. Claritin.
Xylitol.
And the Claritin is sort of a weak antihistamine when you compare it to the others in the studies that I've read. Nothing against Claritin and Claritin Clear. It's a good antihistamine. Some people think it's best for them. So we've got an antihistamine, we've got the nasal sprays. If that's just not doing enough, then what's the next step in trying to get the patient better so that their stuffy nose is being driven that way by dust mite allergy? What else can we do?
So if we're looking for a cure, the best thing that we could do is immunotherapy. And there's really two main types that I use. One would be subcutaneous immunotherapy, or the allergy shot. The other would be sublingual immunotherapy, or a pill or a dust mite tablet. And the dust mite tablet, it's indicated in people that are 18 years of age up to 65. The first dose is given in the office. It goes underneath the tongue, so you want to be sure to take it out of the little foil and then put it underneath your tongue. Wash your hands. That way you don't rub your eyes, especially if you're allergic. And then it's going to sit there for about a minute, and you cannot swallow for a minute, and you can't eat or drink anything for 5 minutes. And then they stay for 30 minutes, and they're able to go.
Is it effective?
It is effective. It's not as effective as the allergy shots, but it is effective.
So the allergy shots, tell me about those. How do they work? What are their benefits?
So the goal of the allergy shot is basically to make you immune or desensitize you to the thing that you're allergic to. So in this case, dust mites. We start out at a really, really low dose or diluted dose, and then increase that dose over time in a safe way to where we get to a therapeutic effective dose to decrease symptoms, decrease reliance on medications, decrease risk factors for other comorbid conditions, things like asthma, something like that. And so it can be very effective.
Now you mentioned asthma, and we were talking about a bad nose and about allergic rhinitis and the stuffy nose and congestion. Can dust mite allergy cause asthma?
It definitely can. Actually, studies show that if you are exposed to a high degree of dust mite allergen, it can increase your risk of developing asthma up to 5 times. So that's pretty significant. That's why it's so important to see a board certified allergist, get the appropriate testing, the appropriate treatment, because these types of things could be preventable.
So board certified allergist has had the training of a year or two, usually a 2-year program, where they understand the skin testing and putting somebody on immunotherapy or allergy shots. The difficulty with the shots, the patient have difficulty with them?
So hopefully not. I try to do a lot of education up front. We are giving the individual something that they're allergic to, so you can have some local itching at the site of the injection. I'm on shots myself, so I know the feeling, so I'm able to share that with my patients. But in general, it's very well tolerated, very effective, and safe.
So it's the next step up, and it's what we really want to go to, and it can prevent you from getting asthma, is that right?
Correct, yes.
Are there further benefits to working around the head of the bed as far as dust and mold?
You're referring to?
Do you have to consider mold allergies?
Yes, yeah, you definitely do.
I was leading in. That's what we're going to be talking about when we come back. Are there other things other than dust mite and pet dander in the bedroom that can be causing your problems and making you miserable? We'll answer those questions and see what you can do. We're talking with Dr. Nick Kolinsky, board-certified allergist, and we've been talking about dust mite allergies and where you can find dust mites in a house and how they cause the allergic problems, including allergic noses and allergic lungs. So we can get asthma and we can get allergic rhinitis that's there every single day if you go in your bedroom every single day. But we find dust mites in other parts of the house too. Well, if a person has a moldy house or a damp house or a house that has a high humidity, where does mold play a part in that person's allergies?
So mold's going to be really anywhere where it's going to be humid, exactly like you said, so a basement, kitchen, bathroom especially. And so anytime you see any mold, no matter what color it is, no matter what it looks like, you're going to want to try to get rid of it. And it can definitely cause allergies. Same symptoms that we're familiar with the dust mites or with pollen. the wheezing, coughing, stuffy nose, itchy, watery eyes, a bunch of drainage.
So it's a real problem. When people have allergic problems with allergic nose symptoms and with allergic lung symptoms, how do they feel in general? What's their well-being? Do they feel crummy?
They definitely feel crummy. They're not sleeping well. And when you don't sleep well, nothing else goes well.
And it makes it difficult when you eat food because you can't eat food when your nose is all stuffy. It's a very, very difficult problem. And I think
Yes.
not enough time is spent on the implications of having underlying nose allergies. Mm-hmm. What about school? Do people perform well? Children, do they perform poorly or better in school because of allergies?
Poorly, definitely. Myself included, when I was younger, I had allergies, and I definitely had more trouble focusing in school. Once I saw an allergist and was diagnosed and put on the right nasal sprays, everything changed for me, and I was really thankful for that.
So do you think it's because when your nose is stuffy, you're not breathing well and you're actually not sleeping well, and therefore you don't perform well the next day?
Exactly. Difficult to focus, pay attention, things like that.
Asthma. How much indoor allergy to dust and mold and pets? And we'll talk a little bit about pets also. Where does that enter into the person's health to getting asthma? What are the chances if somebody has an allergic nose that they'll end up getting allergic lungs?
So it definitely is higher. I think that those things that you mentioned, those allergens, huge, huge risk for asthma and asthma exacerbations and symptoms. And so it's very important to identify those.
So if we identify them, then we can treat them with medications and we can put them on immunotherapy. Will immunotherapy, allergy shots, help somebody with asthma?
They definitely will.
Yeah, so they make it where the allergen doesn't trigger the problem as good.
Right.
It must be a great feeling to be an allergist and to be able to identify what's making somebody sick and not feel well and put them on a program that makes the patient feel better.
It's the best. It's the most rewarding thing I've ever experienced, especially when you see your patients come back next time and they're smiling and they feel so much better. It's awesome.
Yeah. You know, those very things you said is why I ended up going into allergy. I was going into cardiology, and then when I trained in the allergy department, people came in sick and miserable and walked out feeling good and breathing like a human. So it's a great thing to be able to do to help the patient identify what's their problem. What's allergy skin testing like?
So the skin test, I've actually had it done myself since I'm on allergy shots. It's a really simple in-office procedure. It's done the day of the first visit. What we do is we take a little plastic toothpick, we dip it in the allergen, so in this case maybe dust mite solution or mold solution, and then we prick the back. We read that test after 15 minutes, and then for what's negative on the back, we do a more sensitive test called an intradermal test, and that's done on the upper arm.
So what does the positive allergic reaction look like?
It looks almost like a little mosquito bite, so it's going to be this red kind of welted up area. It's palpable, so you can feel the border, and then also it's got some erythema redness around it.
And when you get the skin testing, you've taken the history, then you can make up the extract that you're using for immunotherapy.
Correct.
Nick Kolinsky, you're a great teacher. You really, really are. I have enjoyed learning from you on this show, and I thank you for coming to Dr. Bob Show. I hope you'll come back again.
Well, thank you, Dr. Bob. I learned a lot from you, so appreciate it.
Great show. A lot of information for you. Now we're going to be talking about how taking care of allergies can also improve your overall health. It makes it where you can go outside and exercise. If your allergy is causing asthma, you may have exercise-induced asthma. You have to talk to your doctor about some medications you can use before you go out and exercise. And so that will make you more productive and feel better when you're able to exercise on a regular basis. It also cuts down on anxiety, on pressure, on your blood pressure. It helps you feel better and perform better. Be sure that you're sleeping well. And we talked on the show about having a stuffy nose, how it can make you not sleep well, not rest well, and when you don't sleep well, you don't perform as well during the day. We're learning more and more about sleep hygiene, about the importance of getting a good night's sleep. And we'll do a whole show on sleep hygiene and what you and I can do to be able to sleep better during the night. be sure that your nutrition is good. You need to look at what you're eating and see why you're eating certain foods. More fruits, more vegetables, less fatty, fried food. When you combine all of those, and when you eat a smaller quantity of food, you'll find that your weight will lower itself to the weight that you want, to where you feel like you're in better shape. So it's that exercise, it's that eating properly, it's getting 7.5 hours sleep, and most of all, what is it we like in the Dr. Bob Show? Yeah, it's that laughter in your life. Can you make or teach somebody how to be happy? Well, actually you can. You can do that by reading things that are comfortable to you, by talking with people, by telling funny stories, by reading the comic strips in the newspaper. The more you expose yourself to laughter and to happiness, your immune system will work better. Actually, fighting off infection is much, much better and much easier when you're a happy person. So stay happy, have fun, you'll be healthier, and the people around you will also.